We'll see what happens in that Senate race, obviously very important as well. Donald Trump and his campaign today, they pounced on the news about the Affordable Care Act, Obamacare. The premiums are expected next year to shoot up by an average across the country of 22%. How could that impact the race in Florida over the next 2 weeks? How worried are you about those numbers? Because it's pretty significant that the increase in cost to Americans is going to go up.
You know, I think that voters, when they go to the polls and make a decision about who they want to vote for president, are going to vote for Hillary Clinton because they know that she has been focused on making sure that we can continue to add more people who have health care insurance. We have 20 million people who now have health insurance that didn't before. And when it comes to the rate increases, we actually have the slowest rate of health insurance costs in 50 years since the passage of Obamacare. Look, it's also important to note, Wolf, that insurance premiums went up double digits every year before Obamacare. But now, because of the tax credits that are available to 91% of Floridians and 84% of uninsured and previously uninsured Americans nationwide, most of these folks are able to pay $100 or less in their monthly premium. And so while there are costs that have continued to go up, it's the slowest rate increase in 50 years. And that need to be ironed out. We need to sit down together, like Hillary Clinton has said over and over, with Republicans across the table and iron out those kinks. And that's what we're committed to do, so we can make sure that we can continue to improve upon a plan that has given 20 million people health insurance and given people like me, as a breast cancer survivor who lives with a pre-existing condition, the chance not to worry about being dropped or denied coverage like we'd had to worry about before.
But the number is released yesterday by the Department of Health and Human Services, says for those 5 to 7 million Americans right now who rely on the Affordable Care Act for some sort of level of some sort of premium, on the average 22% premium increases. In some states like Arizona, it's going to go up more than 100%. That's not the way it was supposed to be, was it?
Well, we're in a transition year, and as I said, you have 91% of Americans, of previously uninsured Americans in Florida who are eligible for a tax credit, which brings those costs down. So those numbers are really an anomaly. It's 4 or 5 states where the number of insurance options have narrowed, and so premiums have increased. But we're going to be able to make sure that if we just sit down together and iron out the kinks that have occurred with Obamacare, this was significant reform that brought more health care insurance, for example, to young adults who can now stay on their parents' insurance until they're 26 years old. If you go Donald Trump's way and the Republicans' way, they've forced us in Congress to vote more than 60 times to fully repeal it, to just get rid of it and leave people with no health insurance. 37 million people didn't have health insurance before Obamacare, and now they do. My constituents here in Florida who are seniors had to ask their pharmacist to score their pills so they could break them in half and double the length of time that their prescription would last. Now the donut hole, that prescription drug coverage gap, is closing. So Obamacare has saved millions of Americans money, and now millions more have coverage. We don't need to do what Donald Trump is and pull it up by its root and branch. We need to sit down together and iron out some of the kinks and help make sure that we can improve upon what is already working for millions of Americans.
All right, Debbie Wasserman Schultz, thanks so much. Former DNC chair, Congresswoman up for